Hello and welcome to Straight Talk. I'm Aisha Subarkash. As billions hunker down to try to stop the spread of COVID-19, concerns are growing for the people living in one of the most vulnerable places in the world. Millions live in Syria's last rebel bastion of Idlib, and they face grave risk from the virus. Although a ceasefire signed in early March has kept the fighting to a minimum, the cramped conditions at many camps has the UN and humanitarian groups worried. Although there haven't been any confirmed cases of COVID-19 in Idlib so far, aid workers on the ground aren't taking any chances. TRT World's Middle East correspondent Sarah Firth has a story.
Hooked up to oxygen masks, these children are showing some coronavirus symptoms and are currently being treated in Idlib's hospitals. NGOs have been out in Idlib's camps, taking temperatures and teaching social distancing measures to children and showing them how to properly wash their hands. The hope that these prevention measures will save lives and stop the spread of coronavirus in cramped and crowded camps, areas where an outbreak could add to the devastation the region has already experienced. So far, there have been no confirmed COVID-19 cases in northwest Syria, but Idlib's health directorate has told TRT World that if the coronavirus breaks out here, they are, he says, completely helpless.
عدد المنافس الموجودة عندنا بطبيعة الحال هو غير كافي للمرضى العاديين، مرضى القلب والمرضى الجراحات، العنايات المركزة الاعتيادية. يعني بكل شمال غرب سوريا عندنا 95 منفسي للبالغين، عندنا 29 منفسي و29 منفسي للأطفال والرضع، يعني من كل نوع 29، وما يقارب عندنا 30 سباب، جهاز سباب. هلا هذا العدد من المنافس سواء كان بالغين أو أطفال أو أجهزة سباب هي بالحالة العادية غير كافية للمرضى الاعتياديين.
The Idlib Health Directorate also says the World Health Organization has so far failed on promises they've made to provide vital medical equipment.
منظمة الصحة العالمية وعدتنا بتجهيز 3 مشافي كورونا، كل مشفى بيتسع ل 30 سرير عناية و40 جناح. للأسف لحد الآن هاي المشافي ما تمت على أرض الواقع. دقينا ناقوس الخطر بالنسبة للمنظمات الإنسانية، منظمة الصحة العالمية، إنه نحن بيلزمنا كثير أجهزة تنفس اصطناعي، بيلزمنا أسرة عناية. انوعدنا من بعض المنظمات إنه يعني يوردوا لنا هاي الأجهزة، لحد الآن ما صار شيء.
TRT World put these concerns to the World Health Organization, but they have not yet responded. The threat of death is nothing new for Idlib's population, which has suffered years of intense bombardments during Syria's brutal civil war. Many are now choosing to leave cramped displacement camps to return home, even when home has mostly been reduced to rubble.
الحجر الصحي اللي عم بيصير بدول برا هو نحن عايشينه، نحن عشناه بأيام اللي كان في قصف كتير، بس قوات النظام بعيدة عن مناطقنا، عشناه بالمغر تحت الأرض.
Many people believe it's a matter of when, not if, COVID-19 hits here. And Syrians have been left wondering once again where the world is in its moment of need. Sarah Firth, Straight Talk.
And to break that all down, joining me now from Gaziantep is Yakzan Shishakly, who is the CEO of the Maram Foundation for Relief and Development. Mahmoud Daher, who is the WHO lead of the Gaziantep field presence. And joining me from Belfast is Michiel Hofman, who is a senior humanitarian specialist at Doctors Without Borders. Gentlemen, welcome to Straight Talk. It's good to have you on the program. Yakzan, I want to begin with you. Tell us about the latest situation in Idlib and how are people dealing with the new circumstances?
Well, lucky enough, so far there's no confirmed cases in Idlib, and this is very good news for now, but doesn't mean the people are not living on fear of this COVID-19 virus to break into Idlib. So everybody's trying to take the measures as possible as they can, which is, as you see in the picture now, the camps, to do distance from each other, the social distancing is not doable because of the crowded camp. We're talking about 500 people per 20 tents. So we're talking about a huge number, 5% over the capacity or 50% of the capacity for each tent. We're talking about 5 families living in the same tent. So when we ask them to take the measure for social distancing,
it's not possible. So what is needed urgently? If I'm not mistaken, in all northern Syria, there are just about 200 ICU beds, like all ventilators are occupied. And there are no beds available to accommodate even one case. What can we understand from that? Why all ventilators are occupied now?
I mean, to start with, let's remember, it's a war zone. So we're talking about where the Russian or the Syrian government were destroying most of the hospital exists in the area. So we already under and behind the capacity, the normal capacity. And now talking of the ventilators, it's not easy, even if we have the funding from WHO and other partners to buy those ventilators, will not be easy to buy them and get them inside Syria because of what's happening, the panic happening all over.
Yes, we know that. I mean, also we know that 350 health facilities have been bombed and more than 900 doctors, unfortunately, have been killed by the Russian-led regime forces. So, Mahmoud, as the world rings the alarm bells for a potential humanitarian disaster of Idlib if the virus hit the region, the World Health Organization has lately started sending medical aid to northwest Syria. Could you give us some details about your operations in the region?
Yeah, thanks for your question. I think we have been working at the moment on top of an existing emergency situation in the northwest of Syria. As my friend Yakzan has mentioned, there have been lots of fragility in the area and overcrowdedness. So WHO has been working with our partners in order to support the whole situation, the health provision, the healthcare provision in the area, and to be prepared. In fact, at the moment we don't have a positive case, but the fragility and the risk to have a case can be dramatic in the area. And with the high density of the population, we can see a dramatic situation. So we are working with our donors in order to allocate more than $34 million that are required for the preparedness and response plan.
Yes,
that has been set together with our partners.
Yeah, your organization is consulting with Idlib authorities to draw up a $30 million plan to create 28 isolation units and prepare new facilities. But Michiel, let me get to you. You have worked in the different parts of the world, and I believe you've seen enough. Yakzan just mentioned it, but even developed countries were unable to prevent a full-blown outbreak. How do we expect people to self-isolate in a densely populated refugee camps? How do they wash their hands regularly if there is no water? And how do they access health care if there's a danger or fear of being arrested? I mean, how vulnerable those people are.
Well, indeed, one of the key concerns is the overcrowding in the displaced camps. And of course, as was mentioned, social distancing in these circumstances or self-isolating, as is used in many other countries, is simply not an option. So first and foremost, we have dramatically increased our support to these displaced camps just by providing hygiene kits, soap, but also to double the amount of water that we have been supplying to this displaced camps. That we are working, serving some 100,000 people, so that they can start with the basics, the ability just to wash their hands. They need to have the water and the soap. But at the same time, we have to work on the assumption that even though there hasn't been no confirmed cases, that the virus is there in the region.
Yes.
So to prepare the healthcare facilities that they're able to actually isolate patients and hopefully at some point also provide treatment is also a main priority for us. That includes making sure that the staff in the healthcare facilities has the protection equipment they need for dealing with suspected COVID-19 cases.
Yes, sure. So, Mahmoud, we're talking about Syria in particular. Do you believe that besides medical aid, an intersectoral intervention is needed, both for Idlib and for Syria? Because we also know that, crisis times sometimes present opportunities. Do you believe that this pandemic could, in a way, provide an opportunity of peace building in Syria?
Well, this is a very important element. We have within WHO, we have been raising this issue in many other countries in the world, peace through health. And we have seen how much everybody, not only we, everybody can work together in order to protect the lives of people. This is the opportunity, in fact, to promote cooperation and collaboration among all conflicting partners in order to settle up a situation here. And the COVID-19 is the invisible enemy that is imposing on the whole humanity. So we need to be all united in order to fight this invisible enemy. And without collaboration, without working together, that cannot be done. This requires, as the Director General said all the time, whole of society, whole of government approach.
And also from a broader perspective, Michiel, I want to continue with you. There are 70 million people worldwide, who have been driven from their homes by war or unrest or for economic reasons, and 10 million are currently living in refugee camps. So how alarming is the situation and what should be done, in your opinion?
Yes, indeed, and Bangladesh is one of those examples with millions of refugees packed tightly together in a refugee camp, similar to what we see with the displaced in Idlib, where the public health measures as are taken in many countries, like the isolation or the social distancing, is obviously not a strategy that can be used. So it's more important than ever in those places to obviously provide what can be done, the hand washing and the hygiene measures, but also to have a very good availability of testing, so that aggressive tracing and testing can be done in those circumstances, to try to contain the spread of the virus through those means rather than through the means of lockdowns and distancing. Whether or not that is possible with the global shortage for everything in terms of protective equipment, of reagents for testing and all of that is another matter. But those are the preparations that we are making in these refugee camps like Bangladesh, or in the displaced situations like in Idlib.
Mahmoud, do you think Western countries, which by then may have contained their own outbreaks, would respond to the refugees? Will they look the other way again?
Yes, indeed. We are working with all the donors, and although they have their problems at home, but we are working with many of the donors to continue to respond to the situation in northwest Syria. We have already been receiving calls by donor countries, and that they are very much interested to continue.
But one of your biggest contributors, the United States, has just decided to defund your organization. How will this affect your operations?
Well, that's true. The Director General has said it. We are hopefully looking for the United States of America to look again at the decision that they made. In fact, the United States of America is one of the biggest donors to the WHO and has been for a long time, supporting WHO activities and saving lives. But our COVID-19 are continued at the moment. We have, the United States of America funding is going to other programs, to immunization, to polio eradication, to many other programs that need to be continued as well. However, our COVID-19 response at the moment is going, and we are working with our donors in order to continue that support.
Okay.
Especially in a situation like in Idlib, it's very, very important to keep. This is from the health security point of view as well.
Yeah, but it's not only a problem of Idlib or Syria. Michiel, MSF has ended a cooperation saving migrants at sea with its partner SOS Mediterranean because it suspended the missions due to the coronavirus. And Southeast Asian countries like Malaysia, Bangladesh, and Thailand are reportedly preventing especially Rohingya refugees fleeing Myanmar from entering their waters. What do you think? Are these states instrumentalizing outbreak control measures to justify the international violation of law and human principles at sea?
I can't say if these nations are doing this for secondary motives, but it's obvious that measures such as closure of borders that have been imposed by many nations in order to contain the spread of the virus has an immediate effect for those that try to flee conflict and other situations. So we have been always very clear that closing the borders cannot mean that obligations under the refugee conventions are suddenly suspended. So those people that try to flee still need to have the ability to do so. The suspension of the search and rescue in the Mediterranean was mostly because the Italian authorities did not allow refugees to be embarking anymore at Italian ports. So that is one example indeed where the normal flow of refugees has been interrupted because of these border closures through COVID-19 measures.
All right, and last question, Yakzan, to you. Are you hopeful about Syria's future, and are there any expectations from Turkey during this crisis times?
Well, we always looking at the future as something going to be brightful, and this is what we're very hopeful for. And Turkey, thankfully, the government of Turkey and the people of Turkey being very supportive to the Syrian people, whether as a refugee or even with the coordination, the partnership to work and response to COVID-19. I just want to highlight this last point, a very important. COVID-19 in general bringing also economic crisis to the area where we're going to face more needs for food and other strategic essential equipment and other support.
All right, gentlemen, I'm afraid we have to leave it here. Thank you very much for joining me on Straight Talk. I appreciate it a lot.
Thank you. Thank you.
You're welcome. Thank you so much.
Since the outbreak of the coronavirus, people all over the world have come to grips with a new reality: life under lockdown. A third of the globe has been under some sort of self-isolation at home since early March to help stop the spread of COVID-19. But how have people adapted to life with social distancing and quarantines? Will this be the new normal? To discuss the social implications of the coronavirus outbreak, I'm joined by Sam Richards, who is a sociologist working at Pennsylvania State University. Sam, welcome to Straight Talk. It's good to have you here. You teach classes that reach millions of people through various platforms where you touch on the inequalities stemming from racial and gender divides. You try to have people some sort of empathy in overcoming this. So how has that played out so far in the midst of this coronavirus? Have we become more empathetic?
I think we have, and I think what we're seeing are people watching other people and observing other behavior from around the world and recognizing that in many ways human beings are we're all dealing with this, and we're all dealing with it in a similar way. And I think we're building ties between different peoples and different cultures all around the world, for sure.
So how this is different than the, let's say, previous disasters, previous pandemics, or even conflicts?
Well, this is a pandemic that is reaching everybody. And when we look at previous pandemics like SARS and others that came before, it didn't reach the all corners of the world in the way that this is. Mm-hmm. And this is just different. In fact, we've never experienced anything like this ever as a human species.
Yeah, and how is this crisis and weeks of self-isolation impacting our psychology as well as our social life? Because according to some researchers, people are mostly worried about the effects of the virus on their well-being, grocery, medication availability and the ability to make plans, because people make plans at least for holidays, vacations. Ramadan has just started and the Christian world celebrated Easter under lockdown. How does it change the world and us?
Well, yeah, it should. People should be concerned about these things because this virus has just had a devastating impact on all social systems from top to bottom, and so I think that we are we're used to thinking in terms and planning in terms of the future. It's not just now, but it's a week from now, a month from now, a year from now, and this virus has disrupted all of those things, and our ability to make any kinds of plans whatsoever. And then there's the existential threat coming from the virus that we don't know what our social systems are going to look like down the road.
Under forced lockdowns, people have developed a new form of appreciation, I think. I mean, for health workers, delivery drivers, cleaners, and others at the front line. So do you think, is there any chance that this kind of attitude will hold in the future as well?
Yeah, I think it will. And not only that, but people are going to be more cognizant of the impact of the spread of viruses and how viruses are spread. It's one thing we all know, we have a sense that if we get a flu, if we get a cold, we can spread that to other people. But, it doesn't really sink into the depths of our consciousness to impact our behavior on a day-to-day basis. So, we still will go out in public if we have a flu, or we still might go to a dinner or a restaurant if we have a cold. But I think in the future, we're going to see that people will have a much better understanding of how viruses are spread, and they will not engage in this kind of behavior. Aside from other things like wearing masks, this will become commonplace in the future.
So do you think, will it prompt people to reframe their opinions towards others?
Yeah, I think so. And
in a positive way? Because we've seen a lot of discrimination during this crisis, especially for the Asian people.
Yeah, well, okay, so in my class the other day, we had a conversation about this and spoke with many people online about the impact of the negative perceptions of Asian people. But today it's Asian people, and tomorrow it will be somebody else, and maybe the next time it will be the Americans. So there's a negative impact for sure, but there's also the positive impact, I think, of really recognizing that this virus is an invisible enemy that doesn't care who it takes down.
Yeah. Talking about positive impacts, do you believe, this will help governments to reorient their politics and make substantial investments in public goods as well as our environment?
Well, one would like to believe that once again, some of our international institutions would get some power behind them, some teeth behind them. So the World Health Organization, the UN, and so on. I would like to imagine that governments will take this as an opportunity to come together and really put some teeth into the policies that can be enacted by those organizations. But we'll wait to see. But I don't know how that could not be the case going forward.
Yeah, I guess for many Americans right now, the effect of the virus, especially the economic effect, brings back memories of 2008 financial crisis, and you have President Trump who looked down this virus when it first broke out. Tell us about the social changes in the United States expected to take place in the coming months or years.
Well, so one of the things that's really important to understand about behaviors of Americans that we're seeing is we have a sort of a general distrust of the government in a larger sense. And then when we have leadership at the top who's given mixed messages, it makes it really hard for people here in the U.S. to act in a concerted way. So it's very different from a place like South Korea, let's say. As well, we have a lot of people who are not educated about the basic sort of foundations of science, and so we see a lot of behaviors that really are going against us. So
science will reign in more, you think?
I think so. I think people will once again, it will be just an understanding of how something like how viruses are spread and influenzas and so on, and people will start to take that seriously and recognize that I as a human being need a better understanding of these things.
All right, Sam Richards, I'm afraid we're out of time. Thank you very much for joining us on Straight Talk. Appreciate it a lot. Thank you.
Yeah, thank you.
And that's all for this edition of Straight Talk with me, Ayşe Süberkari. If you've got any comments, do share them with us on Twitter with the hashtag Straight Talk. Also, don't forget to subscribe to our YouTube channel. We'll leave you with some pictures across Turkey of people celebrating the 100th anniversary of the founding of their National Assembly and the World Children's Day. Until next time, take care and goodbye.